You're recognized for 5 minutes.
Thank you, Madam Chair. Mr. Secretary, thank you for being here today. During your testimony before the Senate Appropriations Committee on the Department's fiscal year 2024 budget request, you were asked about the role of pharmacy benefit managers they play in rising drug costs. I know those questions have been addressed earlier, but this is something that the House Oversight Committee is taking a lead on and investigating. You responded, and I quote, "I think we know that there are some folks who are very clever and creative in how they do this work. Middlemen have always skimmed money off the top, and it's a matter of how we can try to keep the resources where they're most needed, with consumers, not with the middlemen." End quote. Now, we've recently seen this idea stated directly from the Chief Financial Officer of CVS Caremark, Aetna, who was quoted on May 31st at an industry conference when asked about the potential reforms proposed in Congress as saying, and I quote, "There's other ways in the economic model that we can adjust if one of those things changes," end quote, and he advises his peers not to worry about Congress. Now, this blatant admission by PBMs of behind-the-scenes control of cost of patients and pharmacies allude to the factors and evidence that have led the House Oversight Committee to examine how these middlemen weaponize their access to patient information at the expense of those they were intended to benefit. So today, every major PBM is owned by a major health insurer and owns or is owned by a specialty mail order or retail pharmacy or all three. So, Mr. Secretary, PBMs were found to have overcharged state Medicaid programs millions of dollars by claiming they paid competing pharmacies higher reimbursements than they actually did. Kentucky, my home state, for example, was overcharged $123.5 million. Are you familiar with these instances?
I'm familiar with the general proposition that you're stating, yes.
So would you say that PBMs engage in self-serving practices at the expense of patients and taxpayers?
Clearly something's going on where consumers are not benefiting the way they should, and many providers are paying more than they should.
Do you believe this is evidence of vertical and horizontal manipulation of the pharmaceutical market?
Mr. Chairman, you're going to where I used to be when I was Attorney General in California, but I will tell you that we need to look closely at these programs because PBMs should not be able to game the system.
And I agree. My criticism of the whole PBM saga is that Congress has been looking at it for a long time. And it's well past time for Congress to do something.
I agree.
And we want, the question I have for you, is there anything as Secretary you would advise Congress to do to cut out this unnecessary middleman that's costing consumers and it's costing Medicare and Medicaid a fortune?
Yeah, Congressman, transparency. As they say, sunshine is the best disinfectant. We need to go behind the curtain to see what they're doing. No one is saying that we don't need someone who can make sure that from the pharmaceutical company to the consumer, the medicine gets to them. It's just how it's getting there. Are these middlemen taking advantage? And so we need to be able to get behind the curtain. So whatever you can do to help us have the transparency.
Well, let me ask you this, Mr. Secretary. Would you be supportive of reforms or limitations to the pharmacy benefit manager model, including preventing PBMs from owning the pharmacies, insurers, and clinics for which they are expected to negotiate?
Yeah. Very interested in exploring all those ideas with you because we do need to make some progress and we do need Congress to act.
If you keep up with much that the House Oversight Committee, which I'm honored to serve with our distinguished chairwoman, Ms. Fox, very, very active member on the House Oversight Committee, we don't agree on a lot in that committee. When I say we, the Republicans and Democrats. But there is 100% agreement and 100% bipartisan support to act on these PBMs and do more than requiring them to be transparent. That's a political talking point. That doesn't do anything. One of the suggestions, and there are bills, I know you mentioned a couple of the bills in energy and commerce, but I think there's support on that oversight committee, bipartisan support. I know Representative Porter, Representative Ocasio-Cortez, Raj Krishnamurti, there are many Democrats that agree with my school of thought that we should break these PBMs up, because you cannot be vertically integrated. I mean, what the PBMs were created to do, and by all accounts, there needs to be someone negotiating these drug prices. What they were created to do and what they are doing is they have gone so far off the reservation. I'm a Republican, I'm all about making money, but this is ridiculous what they're doing. This is costing consumers and taxpayers. So if we're going to have a serious conversation about reducing drug costs in America, and we don't mention the PBMs, then no one serious about reducing drug costs. We have to do it with the PBMs, and we have to do more than require transparency.
Our team's ready to work with you, Mr. Chairman.
Thank you, Mr. Comer.
Sure.